low boil over a fire and then cool it and put it in a sterile baby bottle, it kills the virus. So they figured out a way to make their breast milk safe. All by themselves, no scientist came and told them. So I'm just like shocked that they were able to do this, but also not shocked because women will do anything to save their babies. So let's talk about what had the WHO, and this is a test question, what's the second most cost-effective way to slow the spread of HIV in the world? What's the first one?
Circumcision.
Circumcision of male babies. The second one is treating HIV positive mothers during pregnancy. All right, so remember that you get your antibodies from your mother. When you're born, you get protection from your mother from many diseases. And this is called the colostrum, or first milk. And it gives you baby protection for a good amount of time. So if you antibody test a baby, you're going to be testing its mother, not the baby. Because the baby hasn't developed its own immune system until age 2. So, test question. What's the HIV antibody status of an HIV positive mother's baby the day after birth? Positive. You get your antibodies from your mother. So the babies are all positive, 100% antibody positive after birth. Why? They get their antibodies from their mother. Did they really get infected? You don't know that until you test them at age 2 when their own immune system is functioning. So remember, you can't tell by the cheap antibody test whether a baby is infected at birth or not. Now, if you want to spend $1,500 to do an antigen test to look for HIV, you can, but remember, you can't afford formula, or you're going to have a $1,500 blood test. No. So, all babies of HIV positive mothers are positive at birth by antibody testing. Common, everyday antibody testing. So you have to test them at at age 2 to see if they really got infected either in pregnancy or at birth.
Because are you saying that the amount of the virus will determine if they're going to be at age 2? Or
No.
So they're
I'm
not
saying
actually
that
positive on it.
did the blood from the mother get into the baby during pregnancy or during birth? You don't know. Remember, it doesn't cross the placenta. So if life was perfect, all babies would be negative from HIV positive mother. It doesn't cross the placenta. So unless there's an accident during birth or during pregnancy, the baby should not be infected. But you don't know because the only test we do is an antibody test. And the antibodies of the baby come from the mother. So if the mother's positive, the baby will be positive by antibody test. So you have to test at age 2. At age 2, you can find out, were the babies accidentally infected during pregnancy or at birth during some blood from the mother getting in the baby's eye or something. And so what we find is 66% of all babies do not become infected during pregnancy or at birth. 66% worldwide. In this country where we have better prenatal care, and in Europe, the percentage is 75% of all babies were born negative, but we can't find out until we test them by antibody test at age 2. Remember, the mother's antibodies eventually wear off, dilute out, and the baby makes their own. So if they were infected, their antibody test at age 2 would be positive. And when we go and test them 2 years after they were born, we find that in the United States, 75% of all babies from positive mothers are negative. And worldwide, 66% of all babies from mothers that were positive are negative. Now, we want to know if we can change that, if we can make it less risky, and we have discovered you can. If you give the antiretrovirals, and remember it's called HARRT, highly active antiretroviral therapy. If you give the mother HARRT just a week or two before the baby's due date, you can reduce the number of positive babies from 33% to 12%. If you test them at age 2. Remember, what are they going to be at birth by antibody test? 100% positive. But if you do the antibody test at age 2, only 12% will be positive. Why? You lowered the mother's viral load to 0. No baby's going to get infected at birth, during the birthing process. All right, what if we give it the last 3 months of the pregnancy? And if you give it at the last 3 months, you can change it from 33% worldwide to 8%. That is $100. For $100, you can save, what's 8 from 33? Anybody remember? 15?
Yeah, no.
9, 10,
12.
25.
25. So 8, you can save 25% of the baby for $100. And for $50, you can save about 13% more. Remember, that's where you get it to 12%. And this is at 8. So this is extremely cost effective. Giving these HARRT therapy the last 2 weeks or the last 3 months is extremely cost effective. You can save a lot of children. And remember, each one of these kids is going to, if they're positive, is $100,000 worth of treatment every year of their life. So you're saving a tremendous amount of money for $100. All right, so anyone have questions about pregnancy? Remember, we're talking about antibody testing, not antigen. What's an antigen test? You're looking for what? The virus, HIV. We're not talking about HIV testing because we don't test for the antigen, because the test that is cheap, it only costs $2, is no good. The test that is better costs $500. If we can't feed formula, can we afford $500? And the great test that's $1,500, we can't afford. So we're talking about the dollar test, the antibody test, the ELISA test. If you test the mothers and they're all positive, then at birth, all babies will be positive. If you use the cheap test, the antibody test, at age 2, 66% of the babies will be negative and 33% will be positive. In the United States, 75% will be negative and 25% will be positive. How can you change that? Give the mothers HARRT therapy. If you give them the last 2 weeks, you change that 33% to 12. If you give it the last 3 months, you change that 33% to only 8. And this means 8% were HIV antibody positive. All right, so everybody clear? Anyone have any confusion? Yeah. Oh, and daddies don't count.
If the mother...
Isn't that great? If the father's positive and the mother's negative, it doesn't matter. The father has to first infect the mother before it counts.
What is that drug memory? Where is it?
Oh, thank you so much. Drug memory. What if we give the mother, let's say AZT. That's an old one, but let's say we gave them AZT, and the baby is born and at age 2 tests negative. What if the baby at age 13 ho-hos around and gets HIV? AZT won't work. There is a drug memory on what was used on the mother to prevent them from getting infected, and that drug won't work on the child later in life. And we don't know why. What was your question?
If the mother is negative, still the baby can get the positive through the birth?
No. If the mother's negative, the baby can't catch anything from the air. Okay, so remember the father doesn't matter because he has to infect the mother first. And remember, it takes an average of about 5 times to infect a person through sex. All right, so what are we going to do in a democratic society to prevent the spread of HIV? Remember, all these ideas that the whack jobs have don't work. You can't force test every American. It's against the law to test people against their will. We have freedom here, a little bit left, and you can't put somebody in jail for a disease. Sorry. Now, most people misconstrue quarantine. What does quarantine mean? Quarantine means, in the United States, remember, anybody can take a word and warp it for their own country, but in the United States, quarantine means that the local public health authority is limiting your travel and your access to the public in return for a date that you will be no longer infectious and a promise of treatment if you get sick. So if you get exposed to a disease and your public health department puts you under quarantine, first of all, you have to agree. They can't come in and say, your house is quarantined, you have to stay here. They come in and say, we want to quarantine you because you've been exposed to a deadly disease. And if you agree, we will treat you, and on this date, you will be free. So, can you do that with HIV/AIDS? No, once you're infected for life, so there is no date that you will be safe. And secondly, it's $200,000 a year to treat somebody. Are they going to give you free treatment? No. So, you cannot limit somebody's movement in the United States for a disease. Now you can, with a person's agreement, but nobody's going to do that. So this idea, I don't remember the guy, he ran for president on one of these weird third parties, but one of his ideas was to force test everyone in the United States and quarantine them, anybody that was positive, to keep them from infecting the rest of us. And I always wondered, where were they going to quarantine 2.2 million people? Give them the big island of Hawaii? Okay.
That's good for TV or in New York.
Yeah, like they used to do with the lady that had, what was her, Typhoid Mary?
Yeah.
I mean, you know how many hundreds of thousands they spent trying to keep her away? She wasn't cooperative either. I mean, you know, she said, I don't believe in things you can't see. And the fact that everybody I work for as a cook dies of typhoid is not my problem. So they tried to quarantine her, and it just didn't work out. So remember, now they do this in Cuba. In Cuba, everybody is force tested once every 2 years. If you're found to be positive, you have to move to an asylum. And in the asylum, you get work and training and food and all that, but you must sleep there and you're under their control. And then if you're really good, and you don't violate the rules, you can go visit your family on weekends. But for the rest of your life, you're at the asylum with HIV, and you get treatment and all that. But they have a very small population. And they have got the control, but I mean, can we tell somebody they have to move to an asylum because they have a disease? And can we force test them? And remember, when you're testing somebody, for everybody you find positive, it costs you $100, and we have 700 million people. We can't pay our bills now, so can we test everybody? And then if you do get a little card that says you're HIV negative, what does it mean? Nothing. It means that 90 days ago, you were negative. What does it mean today? Nothing. What'd you do last week? Remember, the test doesn't show positive for 90 days. So unless, the only thing that means something is if somebody was given a little card that says you're positive. How many of you would show somebody a card that says you were positive? Nobody would. So if you get a blood test and it says you're negative, it means that 90 days, 3 months ago, you were negative. It doesn't mean what you did last week. So it's very complicated, the prevention and control of HIV. So number one, we have to tell people how they get it, what behaviors people do that gets them infected. And Don Francis, the guy that set up the AIDS laboratory at the CDC, he came up with what they call the safer sex guidelines. Remember, is there such a thing as safe sex? Nope. There is no safe sex unless you are doing it with yourself in a plastic bubble on top of Mount Olympus. That's about the only safe sex there is. So it's called safer sex. And it says that the only way to prevent the transmission of this disease is to use a barrier that the disease can't get through, which in the current situation is a latex condom. So if a person's going to have unprotected sex with someone they do not know what their HIV status is, then the only thing they can do is use a condom. And a condom will protect you if used properly. About 88% 88 to 96% of the time, that's their effectiveness. So when used properly, you can get about 96% assurity that you won't get infected. And of course, if you don't know their status, that is even better, because it would only be dangerous with someone that had a high viral load. So first thing we want to do is tell people how they get infected and encourage them to use the barrier protections properly. And to, I love the idea where they say you should talk to talk to a potential sexual partner or life partner and tell them all your sexual activities. Don't do that. Just trust me on this. Never, ever tell everybody everything you have done. Find out what you are now and say you're a virgin. Okay? Run to the doctor, get tested, find out what you are now, and then from now on, be a virgin. But for God's sake, don't tell your fiancé everything you have ever done. They will never forget it. I'm just telling you, what the government recommends is not a good idea. I tried that. Work. Alright, so what do we do in this country? We're going to tell people how to prevent transmission of this disease and hopefully encourage them to go, if they have a committed relationship, to both go get tested together and exchange each other's results. Then we want to make sure that we test the blood carefully and that we do pregnancy testing and test the mothers during pregnancy. Then we want to offer everybody what they call free anonymous testing, treatment availability, safer sex education center. Now in LA County there are 1,200 of these. 1,200 places where you can go get anonymous testing, treatment availability, safer sex counseling. The most famous ones are all of the community centers. Every college, every hospital has a HIV testing clinic. The most famous around here is Out of the Closet thrift stores run by our AIDS HMO. Every large city in the USA has an AIDS HMO. Ours is AIDS Healthcare Foundation. It's centered right over here at Hollywood Queen of Angels Hospital, right here on Vermont and, I guess it's Vermont and Hollywood Avenue, or actually, I think it's Franklin and Vermont, I think is where it's at. And it's the AIDS HMO for here. And if you go to any testing center in LA County and you're found to be positive, they will ask you, would you like to join the AIDS Healthcare Foundation? If you have insurance, you join and your insurance goes into a pool. If you don't have insurance, you can still join and pay a $50 copay and see the best doctors in the United States and get the best medications available. Everybody is offered the chance to join this. Now, it is not socialized medicine. It is not, you're going to call in and get an appointment on Fridays, the third Friday at 2 o'clock, because that's your favorite time. You're going to call in and get an appointment, and they're going to tell you you're going to have to wait 2 months for this appointment, and you'd better be there, because it's going to take another 2 months to get another one. In other words, they're not going to cater to you. They are way overwhelmed with the number of people that need to be treated, and so you get an appointment and you better be there, and you go in and you pay your copay and everything's fine. But they are not your private insurance company where you jerk them around according to how you feel. So remember, you do get the best treatment, but for instance, recently when there was that, oh God, what was it that was bacterial meningitis outbreak around, and a lot of people that were HIV positive were very afraid, and they wanted their bacterial meningitis vaccine. And so 2 of my friends that were members of AIDS Healthcare Foundation, they had to wait 3 weeks for an appointment to get their vaccine, because it's just, you know, there's a lot of people there. Anyway, if you are positive, you are offered membership in this, and everybody that's a member gets the best treatment. Who pays for it?
The taxpayers?
Nope. Well, some, but it's going out. The Ryan White Foundation. There is the Ryan White Act, which was passed by Congress, that pays for most of the HIV testing, free testing, and a lot of the treatment. But it is expiring this year, and the Republicans have refused to renew it. So it is expiring. And I doubt if it will get renewed. For some reason, they don't believe that the rest of us deserve to get medications and insurance. The rest of it, amazingly, is paid for by this AIDS Healthcare Foundation and the Out of the Closet thrift store. So if you have anything you want to donate to them, they give you a tax deduction, and that pays a lot. And then the Bill and Melinda Gates Foundation. The Bill and Melinda Gates Foundation pays for 60% of HIV positive people in the United States getting treatment. They also pay for almost all of the vaccine research done outside of this country, and they pay for all of the research on what we call microbicides, which is some sort of chemical that you can add to sexual lubricants to kill sexually transmitted diseases. They're trying to find something, they haven't found one, but they pay for all of that research. So remember, the Ryan White Act pays for a good bit, and the rest is paid for by Bill and Melinda Gates and local charities. All right, so if you go to one of the testing centers, can you walk in and say, I'm a virgin, I've never had sex, I've never shared needles, and I want to be tested for free? They're going to say, crazy person, please leave. There are people that need our services, and you're sucking up the resources because you're a hysterical person. Now go away. But If you come in and say, I am a little bit afraid because I found out the guy I was dating was a big old ho-ho, and he's been screwing everybody on campus and me, and telling me I'm the only one, and now I'm scared. They will say, sure. And you will go in, and they will not immediately give you the little lollipop that absorbs the antibodies, or take your blood. They have an instant test that's just like 20 minutes. What they will do is they will discuss with you what you do when you have sex. Don't be embarrassed. This is all anonymous. Nobody knows. They will ask you what you do and how you do it and how you protect yourself and how you use condoms, if you use them or not. In other words, they're there to find out what you're doing and what you're doing, what's unsafe, and to try to give you hints and ways to make it safer in the future. Then, they don't take down your name or anything. They take down your, your socioeconomic status, your race, the area code you live in, and that sort of thing, and your zip code and that stuff. But they don't take down your name. And then they will give you the test, and then you go shopping for 15 minutes, and they call you back and give you the results. If you're positive, they offer you the AIDS HMO, where you can go find out what your viral load is and what your T-cell count is. And remember, test question, what's the biggest predictor of your future? High viral load or low T-cell? Which one's better? Viral load is the best predictor of survival. So you keep your viral load at 0, your T-cells will go up, but it's not T-cells that measure your future. It's your viral load. So remember, when you go in there, it is anonymous. And why would you rather have anonymous rather than confidential testing? Anybody know what confidential is? Confidential means that you and about 10,000 other people know your results. In other words, you know your result, your doctor knows your result, the nurses in his office know the result, the lab knows your result, everybody knows your result, but it's not put on a bulletin board. And it's not put on a website, which, by the way, is illegal. Knowing somebody's result and telling someone else is illegal. But remember, if you have a confidential, like at a doctor's office, if you get in a lawsuit, they can sue and have your medical records. And they can release them in open court. And people have lost their children in divorces just for being tested, not for being positive. The wife says, so, I want to take care of our children and protect them from people like you, you little slut. Yes, you've been seeing that other woman all this time. And, look at this, for 3 years in a row you had an HIV test. Now, if you've been faithful, why do you need an HIV test? So that means you were ho-hoing around the whole time. Now, the fact you're negative doesn't matter. The fact you're taking chances with our children's future does. And they have lost custody just for being tested. Not for being positive, but for being tested. There's another interesting thing about the law, is that you can be forced to be tested if your job changes insurers, and the new insurance company requires that everybody at that location be tested. Now, you can't individually be targeted, but if your insurance company decides that they only want to test, they only want to insure HIV negatives, and your employer agrees, they can do that. You can't be fired for being positive. You can't be denied housing for being positive. You are considered disabled if you're in what we call HARRT, where you have 500 T cells or less. You're considered disabled and you can apply for disability. The state of California will help you with drugs and treatment if you have 500 or less T cells, but the federal government won't help you until you're in full-blown AIDS, which is less than 200 T cells. So there are a lot of little rules going on here. So what do we want to do in our country? We want to get everybody talking about the safest way to have sex. We want to test the blood banks, have all the blood tested, and test all pregnant women and treat them. We want to offer everybody an anonymous test, and if they're positive, give them treatment. And then we want to continue research into a vaccine because they've all failed. How many body fluids have HIV in them? All of them. Every body fluid that you've got, if you have a high viral load, have HIV in them. How many can infect another person? That's different. Blood, semen and vaginal secretion, cerebral spinal fluid, and breast milk. How many of you do spinal taps on your dates? Okay. You're the only, you haven't done one yet? Oh, okay. So I don't think you're going to come in contact with cerebral spinal fluid. So you have to worry about blood, semen, vaginal secretions, and not many people have breast milk, do they? Okay. I actually grabbed a bottle of my sister's once, but never mind. It was disgusting. Why put that in the refrigerator without labeling it? Never mind. All right, so only these, so sweat, tears, saliva do not have enough HIV to infect somebody. Now, saliva does have HIV in it, but it has it in very low amounts, like about 100 particles per quart. So you have to figure out how many quarts would you have to drink of saliva to get 250,000 particles. Yes, that is disgusting. So remember, there hasn't been a realistic saliva transmission. All right, let's talk about the safer sex guidelines. Always use some sort of barrier. One of the questions on the test is, there is a type of condom called a skin condom that's made out of lamb intestine. It's the oldest. I mean, condoms have been around since the 1700s. Kill a lamb, jerk out their intestines, wash them, and sew one in shut, you got a condom. All right, so that's the oldest kind of condom, and it is made of lamb intestines. And remember, what's the job of an intestine? Absorb nutrients. So they have holes bigger than viruses. So you do, while a lamb skin condom is great for preventing pregnancy because it prevents sperm from meeting the egg, it is not so good for preventing viral diseases. Bacterial, okay, but not viral. Viruses are smaller than the holes in the condom. So why does it say it's not good, but it's better than nothing? Because most men lose their erection as soon as they ejaculate. And in the ejaculate is the white blood cells and virus particles that are dangerous. And so if you just throw him off and say, get away, you're done, then he won't push the viral particles through the skin condom. Since most guys lose their erection immediately after ejaculating, it's unlikely that he'll push them through a skin condom. So it is better than nothing because it prevents pregnancy and bacterial disease, and it's unlikely that if he quits, what do they call it? Quits insertion immediately after ejaculation, it should protect you. In other words, there are guys that will not wear a latex condom. They refuse. They have condophobia. You know, oh my God, it ruins my erection. I can't do it. It's all your fault. You made me wear that thing. It's too tight. Oh. Girls have to be careful with us. We are very fragile. And any little thing, you yell at us, we'll lose our erection. You get mad with us, we'll lose our erection. You turn us on the wrong side, we'll lose our erection. And don't make us wear a condom. My God, we'll freak out and lose our erection. So if you have one of those fragile guys around, it is better to wear a skin one than nothing. Not so good, but better than nothing. All right, so the other ones are latex, they're plastic. Until 88, until 1988, there were only two kinds of condoms, latex and skin. And what happened was that the federal government recommended that everybody properly use a latex condom. And so Bruce Fuller, remember I said there were 3 things he did. Bruce Fuller said, if the government recommends it, how do they regulate them? And so he went and asked, and they weren't regulated. So the government's telling you to put your life in the hands of a rubber device that no one checks to see if it really works or if it's full of holes. Or if companies which have no morality, you remember those in China that pumped up protein by selling poison in baby milk? All right, so lots of companies have no morality, and they were telling the American people the only thing you can do to protect yourself is properly use a latex condom, and they didn't regulate it. So we asked them, how are they regulated? And guess what the answer was? As toy balloons. That's how they regulated them, as balloons. So, Bruce Fuller and I put together a testing program in 1988 to see how good the condoms, latex condoms that were offered in the United States really were, since the government told us they should be used to protect your lives, and we wanted to see how good they were. So we got a grant from the National Allergy and Infectious Disease Branch of the National Institute of Health to go into LA County, to every Rite Aid, to every Walgreens, and we would buy out their condoms. It was fun. We got government checks, and we would go into the Rite Aids in Hollywood and the Walgreens and take everything on the shelves. And we'd have this entire little basket of hundreds and hundreds of condoms. And we would go to the checkout, and the lady would look at us and say, "Planning a party?" And we said, "No, we're testing them." And then we'd pay for them with a government check. And she eyes got really big. So anyway, and this is amazing because both USC and UCLA work together on condom testing. We developed a condom testing protocol to test all the condoms that were sold in pharmacies in LA County. And we picked them at random and just bought buku of them. Now, why didn't we write the condom manufacturers and say, send us condoms to test? They'd send us the best ones. They'd pre-test them and then send us. I mean, that's what good business people would do. It's all about maximizing profit. So we wanted to actually buy what you would buy if you went out and bought condoms. So we did, and we set together a protocol. Just to give you an idea about them. We would take condoms and fill them with nitrogen. And then we would dip them in an electrostatic fluid and run an electric charge over the top to see if they had microscopic holes. We also would fill them with highly concentrated HIV and try to force, with a kind of a plunger-like device, try to force it through them. We would blow them up with air to see how many pounds of pressure they could take. And so we did all of these things, and we were shocked. First of all, this is how we found out. The skin one is, you can push virus through it. So we found that out, and then we found out that 60% of the latex ones were bad. And we were completely shocked that these condoms that they were selling were bad. And we got ready to publish our paper, and Bush the Smarter was president. And Bush the Smarter's advisors told us we could not publish the bad brands. We couldn't put brand names. We could say popular condom brand number 1, popular condom brand number 2. But we couldn't say Trojan or whatever the different brand, or Mentor or whatever. And I was furious. I went completely bananas, over this. Good news is that even though we published without names, Congress was so shocked that they put condoms under regulation. They are now FDA regulated right out here at UCLA at the federal, gosh, I don't know what it is. It's a testing lab right off the campus of UCLA. They randomly test lots of condoms from every manufacturer sold in the United States every day. They test thousands of them, and they don't fail anymore. You know why they don't fail? Because the law says if they fail, then they have to recall. I don't know how you recall used condoms. They have to recall them, and they have to publish the lot numbers and the brand names of the ones that are recalled. And that will cost them a lot of business. So they have never failed again, but every time I look at a condom, I take one out and I look at it and I say, it says lot number and expiration date. I know that we did that because they didn't used to have that. There's a lot number and an expiration date. Now, why were so many bad? We found out why. They're made great. They're made in Korea and in Japan by the millions. The problem is they make them, and if they don't sell them, they store them up to 3 years. Condoms don't last more than 14 months. 14 to 16 months is their lifetime. And it depends on if they're exposed to light or air. So if they're packed in foil, they last longer. If they're packed in clear cellophane, light destroys them more. So you'll notice that those that come in little cellophane that you can see have a shorter expiration time than those that are packed in foil. If they're now, they pack them in nitrogen in foil most of the time. So what we found was that they weren't made badly, they were just old. And old things wear out. And so that was the biggest problem. Here's some other things we discovered. One, did you know that in the United States condoms come in sizes? I bet you didn't know that. If it says ultra sheer, or it says ultra thin, or if it says ultra feeling, it means small. If it doesn't say anything on it about, super sensitive, all of those are small. If it doesn't say anything at all about sensitivity, it's medium. And if it says magnum or XXX, they are large. And these are almost always sold out. At every pharmacy they're sold out. And it's because Americans have gigantic egos. Most men have huge egos, not penises. And so they sell out of these, and you have all these ultra sheer, and then people complain, it's too tight, it's too small. Because you're buying the wrong size, stupid. But anyway, so remember that we do not have to worry about the big problem we had to worry about in the past, which was old condoms in new wrappers. Remember, they would store them and then repackage and sell them here. So they don't do that anymore because they're date stamped and lot stamped. They are now sized, and also we discovered the biggest problem was what we called misuse. And here's the misuse problems we had. Lots of people had the wallet condom. Anybody know what a wallet condom is? That's the one your daddy gives you when you're 13 and says, use it when you need it, and you still got it. Okay? That's a wallet condom. Anything you set on every day is not going to be good. We also had what we call glove box condoms. The people who think they're really studs and they keep a whole package of condoms in their glove box in their car, it gets over 190 degrees in your glove box. That destroys condoms. They've got to be kept like wine, out of the light and in a nice room temperature situation. You can't freeze them, nor can you get them hot. Keep them in your sock drawer where mother can find them. Okay? So, the other thing is we found that most people were using them wrong. I asked my sister what kind of birth control they use. Remember, they have 7 boys. And she said that they use condoms, but they only use them when she's fertile. So she plots it on a calendar the days they have to use a condom. People who use this method are called parents. She said, oh, we also only use them to bag up the ejaculation. So we make out, we kiss, we insert, we have a lot of fun, and just before he's about to orgasm, we'll whip that thing out, slap a condom on it, and pound it back in. As soon as a man is erect, he loses Calver's fluid. That sticky fluid has enough sperm to get someone pregnant, and it has every disease he has. You don't have to ejaculate to be infected, or remember, for 5,000 years we've been telling girls that we'll just pull out. 1, we don't usually just pull out, and 2, you can get pregnant without ejaculation. And for 5,000 years, girls have been falling for this. Be the first generation that knows that men lie and that you can get pregnant from just the pre-cum alone. You can get disease and pregnant from the pre-cum. So the last thing that we found was that 30% of all Americans use the wrong lubricant with a condom. A latex condom cannot be used with mineral oil. Mineral oil will break down a condom in 10 seconds. If you don't believe me, take a condom. I used to have like a whole hour of demonstrating condoms. We'd even packed out cucumbers and everybody would try them on, you know. But we don't have time for that anymore. But take a condom, unroll it, and pull on it. It'll stretch really big. Then dip it in baby oil and pull on it. It will shatter with the least bit of pressure. And guess what? The #1 most favorite lubricant in the United States is baby oil. #2 is Vaseline. #3 is Vaseline Intensive Care. And #4, suntan oil.
Oh,
They
wow.
must have been at the beach. You know? They were using suntan oil in a condom? Insane. So remember, what things destroy condoms? Light, air for a long period of time, high or low temperatures, but the one thing in use that destroys it is any lubricant with a mineral oil. You have to have water-soluble lubricants. There's a gazillion of them now. It used to be just KY. Now there's a million lubricants for latex condoms. I know I took my mother to, what was the name of that? Pleasure Chest on Santa Monica. She's 88, and I took her to the Pleasure Chest. She had such a good time. Yeah, she was like over in the edible underwear section, and I had to get her out of there. And then I took her and she says, "Why does everybody need all these lubricants? You just need one." And I said, "Because they have different flavors." She said, "Why would they need flavors?" Anyway, that was fun. So anyway, everybody have the cautions on latex condoms. Put it on as soon as the male's erect. You don't put it on when you need it. You put it on as soon as the man gets an erection. And remember, it is always better to put a little bit of water-soluble lubricant on the penis first, then roll down the condom, then add some to the outside. Can anyone tell me why you put a little lubricant on the penis before you put the condom on?
Short tear.
Hmm?
There's no friction inside.
That's a good point, but no.
It will rip.
Nope. Air doesn't transmit feeling. Liquids do. So if you put a condom on a penis, it will trap air between it, and the guy will be just like banging against the wall. He won't feel a thing. But if you put liquid in between, not a lot, just enough to dampen the outside of the penis, and then put the condom over it, and then lubricant on the outside, it will transmit 80% more feeling. Just a hint for the fun. Right? I mean, you're not doing it just to have a baby, I hope. All right, so anyway, after this, Bruce Bowler thought that, 400 years and no new brands of condoms might be a bad idea. So he sponsored a conference that I went to and was on, where we were going to design a better condom. Remember, at that time, 1988, we only had the latex condom and the skin condom. And so there was a big push to design a better condom, so we enlisted people. We were going to pay, well, we did pay $5,000 to anybody that could design a better condom. It was hilarious. Especially the female condom. The things we got, you would not believe. But I must admit, the funniest day of my whole life was seeing the people compete for the female condom. One guy brought in a pair of latex panties with straps that had something that looked like an umbrella cover sticking out of it. And what they did was they put on these latex panties and put the little straps over there to hold them up, and then they lubricated this thing that looked like an umbrella cover and put it up inside the vagina, and that was a female condom. And you could fold it up into a 6 by 6 inch cellophane package. It was hilarious. Then we had the spray-on. They have those in Germany. They've been approved in Germany and Amsterdam. It's a type of like rubber cement, and you spray it on once you get the erection. You can't spray it on before because it's straight. Right? So you get the erection and you spray it on, and you can actually get it in ones that glow in the dark. Yeah, you see this thing bouncing around in the dark. But a spray-on condom. It never got approved here, but it is approved in Germany. And then afterwards, you just roll it off. Yeah, it's kind of neat. So anyway, what did we come up with? We came up with the Avanti, which is polypropylene. It's not latex plastic, it's polypropylene plastic. It's a little bit more expensive than the latex. Latex you can get down to 10 cents a piece at Planned Parenthood. They bought huge numbers and they can get it down to really cheap prices. The Avanti is made out of polypropylene, and it has all the advantages of that plastic. And it is so, remember the big problem with latex was it would, tear and break, especially with a mineral oil. Well, the Avanti, you can use anything as a lubricant. You can use olive oil, Crisco, axle grease, mineral oil, water soluble. You can go out and just grab something from underneath your car and rub it on it. Okay? It will work. Nothing will break it. If I give her one end of it, I get the other one, we can run a Mack truck through here and it will bounce off. I can jump off the building and hold myself by a Avanti condom. However, they don't stretch and they come in one size. So if it doesn't fit, you can't make it fit. So the advantage of the Avanti condom is, number one, what? Any lubricant. Number two, it won't break. What's the disadvantage? Number one, what? One size fits all. And number two, we gave it to prostitutes and we said, here, have 500 of them and go out and do your work. And they came back and, they wrote their opinions. And they really liked it except for one thing. It's not good for prostitution because it is a rougher plastic. It doesn't feel rough, but in use, you can't have more than 3 clients in a row. If you do, you'd be walking like this. They say it makes things very sore down there because it's rougher. So remember, not for us, because how many of you have 6 or 8 partners a day? Okay, not many of you have that much sex, so I don't think it'll be a problem for you, which is why it's on the market. So remember, advantages, number 1, really strong. Number 2, any lubricant will work. Number 3, it is stronger. Okay, disadvantages, a little bit more expensive, a little bit rougher, so you couldn't have many sexual acts in a row. And yes, that's it. All right, let's talk about the female condom. It's made out of a third type of plastic. It's softer than the Bonte, but not as soft as latex. It is a plastic bag. It looks like this. This is plastic, this is plastic. These are sort of a hard plastic ring here and a hard plastic ring here. So you lubricate it up and you compress this ring and put it up in against the cervix, and this one folds over the outer lips. And this is the female condom. They're about $3 to $5 a piece, which makes them rather expensive. But we wanted them for one reason. We wanted something women could control. Because lots of times in interrelational situations, a woman will say, "Are you going to use a condom?" And you'll say, "Why should I use a condom? You think I'm some sort of faggot or something?" And then you're in this sort of, oh my God, we're going to have sex, but he's not going to protect himself, and what am I going to do? So in that situation, one would say, okay, fine, it's your body. I'm using a condom. No, it's my body. So a female is given a choice to wear a female condom. And so that we like. There are people that are so hyper afraid that they'll use both, a male condom and a female condom. That's a bit over the top. What's the advantages of the female condom? The number 1 is a female can control it. In other words, she can use it if she wants to. It's her body. That's the big one. Now there are lots of disadvantages. 1, cost. Number 2, it's slightly less effective for pregnancy. And disease. Why? Men cannot often control when they're going to ejaculate. You can't, oh God, you've got 4.5 seconds, You can't do that. So if a man is on his way out and he ejaculates, he can shoot around it. And it can leak back inside from the outside. So it's slightly less effective because men can shoot around it. The third one, which I don't really think is a disadvantage, but I have to list it, is it makes a sound. And I always said just turn up the stereo. But it does have a sound to it. So those are the disadvantages. Oh, we did put cost, okay. Now, we tested this with female married doctors. Doctors who were female that were married. And the funniest thing about this one when we tested it was that some of the women reported that they liked it so much that they felt virtually nothing interfering with their sex act, and their husbands didn't even know they were wearing it. Now to me that's terribly disturbing. Because if men don't know any more about what's going on down there, and she could be wearing this big plastic device and he wouldn't notice it, perhaps that's the reason we have such a high divorce rate. Because men don't know what's going on down there. I mean, that really kind of disturbed me. But anyway, so it's a female condom. It's made of a third kind of plastic, so any kind of lubricant's okay with it. It is basically a plastic bag with 2 rings. For $100, you can save, what's 8 from 33? Anybody remember? 15?
Yeah, no.
9, 10,
25.
25. So 8, you can save 25% of the baby for $100. And for $50, you can save about 13% more. Remember, that's where you get it to 12%. And this is at 8. So this is extremely cost effective. Giving these HARRT therapy the last 2 weeks or the last 3 months is extremely cost effective. You can save a lot of children. And remember, each one of these kids is going to, if they're positive, is $100,000 worth of treatment every year of their life. So you're saving a tremendous amount of money for $100. All right, so anyone have questions about pregnancy? Remember, we're talking about antibody testing, not antigen. What's an antigen test? You're looking for what? The virus, HIV. We're not talking about HIV testing because we don't test for the antigen, because the test that is cheap, it only costs $2, is no good. The test that is better costs $500. If we can't feed formula, can we afford $500? And the great test that's $1,500, we can't afford. So we're talking about the dollar test, the antibody test, the ELISA test. If you take the cheap antibody test, whether a baby is infected at birth or not. Now, if you want to spend $1,500 to do an antigen test to look for HIV, you can, but remember, you can't afford formula, or you're going to have a $1,500 blood test. No. So, all babies of HIV positive mothers are positive at birth by antibody testing. Common, everyday antibody testing. So you have to test them at at age 2, to see if they really got infected either in pregnancy or at birth.
Okay, so then you're saying that the amount of the virus will determine if they're going to be at age 2? Or
No.
So they're
I'm
not
saying
actually
that
positive.
did the blood from the mother get into the baby during pregnancy or during birth? You don't know. Remember, it doesn't cross the placenta. So if life was perfect, all babies would be negative. From HIV positive mother, it doesn't cross the placenta. So unless there's an accident during birth or during pregnancy, the baby should not be infected. But you don't know, because the only test we do is an antibody test. And the antibodies of the baby come from the mother. So if the mother's positive, the baby will be positive by antibody test. So you have to test at age 2. At age 2, you can find out, were the babies accidentally infected during pregnancy or at birth, during some blood from the mother getting in the baby's eye or something. And so what we find is 66% of all babies do not become infected during pregnancy or at birth. 66% worldwide. In this country, where we have better prenatal care, and in Europe, the percentage is 75% of all babies. Low boil over a fire, and then cool it and put it in a sterile baby bottle. It kills the virus. So they figured out a way to make their breast milk safe. All by themselves, no scientist came and told them. So I'm just like shocked that they were able to do this, but also not shocked, because women will do anything to save their babies. So let's talk about what had the WHO, and this is a test question. What's the second most cost-effective way to slow the spread of HIV in the world? What's the first one?
Circumcision.
Circumcision of male babies. The second one is treating HIV positive mothers during pregnancy. All right, so remember that you get your antibodies from your mother. When you're born, you get protection from your mother from many diseases. And this is called the colostrum of first milk. And it gives you baby protection for a good amount of time. So if you antibody test a baby, you're going to be testing its mother, not the baby. Because the baby hasn't developed its own immune system until age 2. So, test question. What's the HIV antibody status of an HIV positive mother's baby the day after birth? Positive. You get your antibodies from your mother. So the babies are all positive, 100% antibody positive after birth. Why? They get their antibodies from their mother. Did they really get infected? You don't know that until you test them at age 2 when their own immune system is functioning. So remember, you can't tell by just the mothers, and they're all positive. Then at birth, all babies will be positive. If you use the cheap test, the antibody test, at age 2, 66% of the babies will be negative and 33% will be positive. In the United States, 75% will be negative and 25% will be positive. How can you change that? Give the mothers HARRT therapy. If you give them the last 2 weeks, you change that 33% to 12. If you give it the last 3 months, you change that 33% to only 8. And this means 8% were HIV antibody positive. All right, so everybody clear? Anyone have any confusion? Yeah. Oh, and daddies don't count.
If the mother.
Isn't that great?
Great.
If the father's positive and the mother's negative, it doesn't matter. The father has to first infect the mother before it counts.
What is that drug memory? Why is that?
Oh, thank you so much. Drug memory. What if we give the mother, let's say AZT. That's an old one, but let's say we gave them AZT, and the baby is born, and at age 2 tests negative. What if the baby at age 13 ho-hos around and gets HIV? AZT won't work. There is a drug memory on what was used on the mother to prevent them from getting infected, and that drug won't work on the child later in life. Okay? We don't know why. What was your question?
If the mother is negative, still the baby can get the positive to the birth?
No. If the mother's negative, the baby can't catch anything from the air. Okay, so remember the father were born negative, but we can't find out until we test them by antibody test at age 2. Remember, the mother's antibodies eventually wear off, dilute out, and the baby makes their own. So if they were infected, their antibody test at age 2 would be positive. And when we go and test them 2 years after they were born, we find that in the United States, 75% of all babies from positive mothers are negative. And worldwide, 66% of all babies from mothers that were positive are negative. Now, we want to know if we can change that, if we can make it less risky, and we have discovered you can. If you give the antiretrovirals, and remember it's called HARRT, highly active antiretroviral therapy. If you give the mother HARRT just a week or 2 before the baby's due date, you can reduce the number of positive babies from 33% to 12%. If you test them at age 2. Remember, what are they going to be at birth by antibody test?
Positive.
100% positive. But if you do the antibody test at age 2, only 12% will be positive. Why? You lowered the mother's viral load to 0. No baby's going to get infected at birth, during the birthing process. All right, what if we give it the last 3 months of the pregnancy? And if you give it at the last 3 months, you can change it from 33% worldwide to 8%. That is $100.